This announcement by Donald Trump and around about, about an hour ago now, where he talked about this Moderna trial. So the first patients are kind of receiving doses today. Can you describe the excitement that might be felt in the US about this at the moment, or is it kind of tempered because there are so many other companies that are working towards vaccines at the moment and it's going to be months away anyway?
Well, I think it is. It's a strange moment in America right now because, in some ways it feels like we're back in March. We've got a situation with Major League Baseball that feels very similar to the one with the National Basketball Association, where several players have just tested positive. Meanwhile, cases are surging in, more than 3/5 of the states. And yet we also have what seems to be positive news on the vaccine front. The Trump administration has made this their top priority. To a large extent, it feels like their sort of last gasp. It's the only thing that they're really putting a great deal of priority on as a public health measure. And yet we'll have to see. I mean, it seems like we're still several months away, even if this were to be expedited, even with the administration's Warp Speed program.
Yeah, what is that program? Operation Warp Speed.
Well, it's as with many things, it's got a kind of catchy name that the president liked a lot. But I think it sums up the president's approach to this crisis, which is that he's looking for a quick fix. And they've decided that, having sort of lost out on all of their other attempts and certainly not trying to do anything on a federal level to contain the virus, that they're putting all of their eggs into finding a vaccine before November's election. We might already be at a point where that's not possible, and yet they are, allocating several, or seem to be allocating significant resources to making sure that we're able to get hundreds of millions of doses of a vaccine very quickly.
Well, Anthony Fauci believes that one could be around by October, November, right? Or is he a bit off the mark there?
I think that, you're certainly hearing from public health officials, I think, tempered optimism on this front. And certainly we've seen a number of trials show some positive results. I think it's just difficult to look at the goat rodeo that's been the administration's response to the coronavirus and then say that, well, they will be able to effortlessly and perfectly distribute this vaccine. I don't see a lot of evidence there, even if, again, they have the backing of folks like Dr. Fauci.
The goat rodeo, that's an interesting way to put things. Can you talk to us about the National Security Advisor who has tested positive to COVID-19?
Yeah, I mean, this is, again, it's only the latest person close to the president. People close to Robert O'Brien have briefed the president. O'Brien has been close. The Trump cabinet, you see them regularly not wearing masks around. You've seen other instances which I think are concerning. For instance, the president's son's girlfriend, who was nearby him on the July 4th call, then traveled with members of his immediate family after testing positive. The administration, as they have done repeatedly when this has happened, has sort of downplayed the concerns here. But I think that they're real. And again, it's worth underlining that people close to the president continue to test positive. And the administration's, although they say that the president is being tested multiple times, I think there are concerns about the protocols.
Yeah, I mean, is he at risk on this latest instance? Or, I mean, he does get tested fairly regularly, as you rightly point out there.
Yeah, I think that there doesn't seem to be a significant risk. And in the case of this particular person, they said, he had traveled and somebody in their 20s had gotten it and he quarantined fairly quickly. But I think, again, what we're looking at, too, is just the larger problem with the virus in America, where we continue to act as if things are mostly normal. And yet, again, people close to the president continue to fall ill.